Obviously, we are sitting in a situation where we've had an extraordinarily successful rollout of the government's vaccine scheme, but we've hit what the Matt Hancock, the Health Secretary, called a lumpy supply for the next month, which means the programme will grind to a halt for those under the age of 50 for the next month. This comes as Labour is calling for an urgent public inquiry to be started into the government's handling of the pandemic from the very start to where we are now. Well, let's talk about that with Rachel Reeves. She's Labour MP and Shadow Chancellor of the Duchy of Lancaster, shadowing, of course, Michael Gove in that role. Good morning to you, Rachel.
Good morning, Julia.
Can we just start, before we talk about the public inquiry, with where we are right now in terms of the vaccine rollout? Undoubtedly, whatever the failings of the government in any other areas, which we'll go into in a moment, the vaccine rollout has been a huge success. I'm getting mine tomorrow at 52. We're told, though, that we were expecting people under 50 to start getting the rollout next month. That's now, we're told, not going to happen. There seems to be a shortage of supply. Matt Hancock, as I said, called it a lumpy supply issue. Is this a major setback, or is this just par for the course when you're dealing with a major vaccine rollout?
That's fantastic, Julia, that you're getting your vaccine tomorrow, and good luck with that. I think that we all knew that you were likely to have ups and downs in terms of the vaccine distribution. But what we want today from Matthew Hancock when he speaks in the House of Commons later is just some transparency and understanding of what exactly the problems are and what actions the government are taking to get the vaccine rollout back on track, because it has given us all that lift and that hope that we've been craving really for over a year now, that there is an end to all of this. And so that's what we're looking for greater transparency and openness from the Health Secretary this afternoon in Parliament.
There was a thought at first, given what the European Commission President Ursula von der Leyen had to say yesterday about a threat to actually withhold supplies of the vaccine to the UK and to other countries, ban exports, even at one point talking about basically seizing AstraZeneca factories to get hold of a jab, which bizarrely many of her European Union members, Germany, France, Italy, Spain and others, seem to think is unsafe. So I'm not quite sure why they want a jab. They don't seem to think it's safe. But there was some talk that it might be a European Union to blame. It appears not. It seems to be supply of jabs coming from India. In terms of the EU threat, though, would Labour support the EU in any export ban? You've always believed very much in the EU, wish we hadn't left, wish that we we're all part of the EU. You criticise the government for going it alone in their vaccine supplies, think they should have gone with the EU plan. Do you think the EU would be right if they decided not to export vaccines to the UK or anywhere else, but kept them for their own people, given how much further behind they are on the vaccine rollout?
Well, Julia, I voted for the government's trade and cooperation agreement, their Brexit deal, in December last year. So that debate has definitely moved on. I've just got to make that deal work now. I wouldn't support export bans from the EU or anywhere else. Vaccine nationalism is not useful. It's not helpful. It's not going to protect our people. We need countries around the world getting their people vaccinated, using the vaccines that are proven and working, including the AstraZeneca vaccine. And I would urge the EU to ramp down the rhetoric and get on with vaccinating the people of Europe.
OK, well, let's talk about the issue that you're most concerned with right now, which is throwing Labour's weight behind a full-blown public inquiry to learn the lessons of the COVID pandemic, how we got to this point almost a year to the day when we went into the first lockdown. In fact, 2 days ago, a year ago, we actually effectively began the lockdown. Lots of people already, we're seeing pubs and restaurants closing and people staying in their homes. What is it that you want from the government that they're not already willing to do? Because we know there's going to be a public inquiry. The government has said there'll be a public inquiry, just not yet. What do you want more than that?
Well, I spent quite a lot of time recently, Julia, talking to the families of those who have lost loved ones during this pandemic. And I think in a public inquiry, we've got to be led by them and their need for answers, for closure and for justice as well. But also, crucially, we need to learn lessons, because I don't think any of us honestly think that this virus has gone away, or that there won't be other viruses and pandemics and diseases in the future. And we've got to protect ourselves from those. Now, we've had a year now, as you've said, Julia. I think there should have been a rapid review last summer to learn lessons as we went into the autumn and the winter. And maybe if that had have happened, we might have locked down a bit quicker in the autumn and in Christmas time, and that might have prevented some of the deaths that we saw, the 125,000.
It's a big might, though, isn't it? Given that the Labour Party's mantra has been constantly, we should have locked down sooner, we should have locked down longer, we should have locked down more strictly. We are currently still in one of the strictest lockdowns in the world at this time. We've had numerous lockdowns, as have many other countries around the world, including many of our closest neighbours in Europe. They've still got a pandemic ongoing. We've seen numbers going up in France, Italy and Germany. They locked down far sooner than us. They had far stricter lockdowns than us, and yet they've still got higher case numbers right now. Is there just the possibility that we should entertain that lockdowns don't actually solve this problem?
Well, 125,000 people and rising have died in the United Kingdom over the last year. Clearly lessons that we need to learn from.
Do you learn the lessons of the fact that lots of other countries have also locked down, and they did exactly the sort of lockdowns that you were calling for this government to have done, and yet they've still had similar numbers dying per capita, and they're still having rising numbers now? Is it a possibility that locking down earlier, locking down stricter and locking down longer wouldn't actually have made any difference? Because it doesn't seem to have made any difference anywhere else.
Well, Julie, we've got one of the highest death rates of anyone.
But there are lots of different reasons for that.
And in a way, you're making my argument for me and making the argument of the bereaved families that we need a public inquiry to understand what needs to happen. And I think, Julie, thanks for saying that. We do need a public inquiry. And the question is,
but everyone knows we need a public inquiry. It's been accepted for a long time we're going to have a public inquiry. It would be inconceivable to not have a public inquiry. But you're saying it needs to start right now while we're still dealing with the pandemic.
Julia, is that the inquiry should start when the roadmap is completed, and the government saying that will be the 21st of June. It seems to me that's the perfect opportunity to get on with this inquiry to help us learn lessons, because, as I say, this virus is still with us. And if we can learn lessons on PPE, on contact tracing, on protecting our care homes, on lockdowns, then perhaps we can better protect our people. And with 125,000 deaths and rising, we do need to learn those lessons.
Okay. Would we also learn the lessons, though, of whether or not any of the policies that have been pursued in the last year have been the right policies, given what we've seen with countries that haven't locked down, like Sweden and American states that have come out of lockdown sooner than others? Because when you say you talk to the loved ones of those who've died of COVID, have you also talked to the loved ones of those who've died from untreated cancer, those who've died alone in care homes, unable to see their families, of dementia after months alone? Have you spoken to the people who've lost their jobs, the people who've lost their businesses, the children who've missed out on their education, whose lives will be blighted for decades and decades to come, the women forced to give birth and go to scans and find out they've miscarried alone without their partners? Have you spoken to all of those people? Because those people are also the victims of the government policy dealing with the pandemic.
It sounds like a surgery that I have regularly in my constituency, Julia, on all of those things. And, I spoke to a retired teacher in my constituency just the other day, who was telling me that his mum and dad both had COVID in hospital. One of them went back home, one of them went into a care home, and almost everyone in that care home lost their lives. So, yes, I'm speaking to all those people. My kids have missed out on a lot of school over the last year, and know the impact on children around the country. And so, on all of these, we need to understand what has happened.
Okay, well, no doubt we'll find out. The line is cutting out a bit, and I know also you do have another interview to go to, so I won't keep you any later, as obviously we don't want to go over our time. But Rachel Reeves, we'll have to leave it there. I really appreciate you joining us. Shadow Chancellor, the Duchy of Lancaster. Thank you for that. A quick word from Steve Allen, who's listening to all of that. Obviously, there are lots of other aspects of stories to get into, but again, time is always against us with guests who are on a media round. But she's talking about getting that investigation, that inquiry, public inquiry, getting it going, June the 21st, assuming that is the date we're finally out of restrictions. Now, I mean, we certainly need to get that inquiry happening, and we need to have it sooner rather than later. I suppose the question is really not necessarily when it starts, but when it finishes. These things have a habit of taking about 5 years, judging by previous situations.
Yeah, I'm glad we're all on the same page in terms of not having this start until we're out of lockdown. If you want to make a little pyramid of what's important, get this exit from lockdown done properly. I never want to hear the word again ever. And then, yeah, the investigation is going to be done. I can see there is a good argument that we need to learn lessons in case there's another pandemic. I feel there are lessons we'll need to learn before then, because odds are there won't be another pandemic for, let's hope, our lifetimes, whereas there'll be other lessons to learn about how things are done, how the government works. They're the results that we need before the more headline, what should we do in the event of a pandemic? There'll be other crises that we have to get through first.
Okay, thank you very much indeed for that.